Hi, it's Mary, a traditional Chinese medicine tutor and an acupuncturist in Canada.
Today's video discusses the hollow pulse, drum skin pulse, and their differentiations. Both of them are floating, large under light pressure and feels hollow when pressing a bit harder. The hollow pulse feels soft, but the drum skin pulse feels hard. Both pulses indicate the loss of blood and damage to yin, but the drum skin pulse is seen in more severe and chronic conditions.
The hollow pulse and the drum skin pulse
are multi-featured pulses.
Hollow pulse.
Hollow pulse is floating, large,
and hollow inside, feeling soft as if pressing a scaling tube. The hollow pulse has 4 features. 1. It is floating in pulse steps. 2. It is large in pulse shape. 3. It is hollow inside, as there is not much blood running inside the blood vessel. 4. The pulse force is soft, as if pressing a scaling tube.
Hollow pulse with light pressure, you find it, and the size is big. However, use the pressure to push it, it feels empty because it is empty
inside the vessel.
When you think about hollow pulse, you think about
pressing the scaling tube.
The tube should be soft
and hollow inside.
Hollow pulse suggests the blood volume is not sufficient. It suggests loss of blood and injury to yin. Yin, sometimes we call it yin liquid, constitute of essence, blood, and the body fluid. The hollow pulse is always related to failure of the blood volume to fill vessels due to the reduced amount of the blood volume. In that situation, yang qi is unable to attach to the yin liquid. When there is huge loss of blood, the yang will follow the bleeding and the escaping out of the body and floats and scatters outside. That is where you see the pulse is large because of yang floating out. It's floating, it's large, and it's hollow. That's the hollow pulse. It can be caused by sudden loss of blood, such as hematemesis, like vomiting blood, hematochezia, like the feces contains blood, profuse uterine bleeding, massive loss of blood, severe loss of body fluids.
The body fluid
is part of the component of blood. So severe vomiting, diarrhea, sweating after a febrile disease
can lead to
severe damage or severe loss of body fluid. Those all can lead to the reduced amount of blood volume. Therefore, you see the hollow of the vessel.
Drum skin pulse.
The drum skin pulse
is floating, large, hollow inside, and feels hard,
like touching the surface of a drum.
The drum skin pulse is the English translation of 革脉. 革, which is Chinese pinyin, means leather. The drum skin is made of leather, and the drum is hollow inside. This image can help you understand the 4 features of a drum skin pulse. 1. It is floating regarding pulse steps. 2. It is large in pulse shape. 3. It is hollow inside the blood vessel. Compared to the insufficient blood volume inside the vessel shown in the hollow pulse, the lack of blood volume in the drum skin pulse is more severe and exhausting. 4. It feels hard regarding pulse strength, as the vessel has become hardened or tense, as though you are touching a strained drum skin.
The drum skin pulse suggests depletion of essence and blood. Depletion of essence and blood leads to yang qi is unable to attach to the yin liquid, qi floating outwards.
The depleted yin liquid cannot check yang, making the pulse floating, large, and hollow inside. Feeling hard
without any manifestations of harmony, The strong skin pulse is the pulse does not show stomach qi and often indicates a critical situation.
Strong skin pulse is often seen in conditions such as
Blood exhaustion, essence consumption, miscarriage, uterine bleeding.
Comparison between hollow and drum skin pulse.
Here is the comparison.
Between hollow pulse and the drum skin pulse. Both of them are floating, large, hollow inside, but the blood vessel itself is very different. Hollow pulse is soft,
As though palpating the scalding tube.
the drum skin pulse will feel hard, tense, or thick, while inside the blood is insufficient and outside the vessel is very hard, drum skin like. If you look at the big picture about the patient, there actually has big difference between the hollow pulse and the drum skin pulse. The hollow pulse usually associated with acute disease, acute like sudden profuse bleeding. Everything's still okay. So you see the softness of the vessel. There's no hardening of the blood vessel yet. For the drum skin pulse, to let the blood vessel harden, it is the contribution of long-term disease. Long-term chronic bleeding will lead to the drum skin pulse. In terms of the yang qi outward floating, the hollow pulse is not obvious because it's a sudden stage. But for the drum skin pulse, it's obvious to see the yang qi outward floating.
Due to much less yin blood inside the vessel that cannot check yang.
Then age difference can contribute to this. For young people, their blood vessels are still flexible. So you see the soft, this soft is moderate, normal range, comparatively speaking. But for the aged people, usually due to the age with the yang qi deficiency, the tendons become rigid. Therefore, you see rigid blood vessels.
There is another possibility. When a person already has a hollow pulse due to the depletion of essence and blood, but later contracts a cold pathogen that stagnates in the exterior and contracts the blood vessels, leading to a feeling of hollow inside but hard outside. A strong skin pulse is thereby created.
If you find this video helpful, please give me a like, subscribe to it, and share it with others. See you in my next video. All the best!